Most of the time, women do come with various problems to urogynecology clinic. One of the major causes why women come for urogynecology is if they have problems with leakage of urine, or if sometimes they feel that their uterus or the womb is coming down the vagina, they feel like a lump or swelling down in the vagina. So these two are the common reasons why people might require a urogynecological surgery. One is called prolapse, another is called urinary incontinence or leakage of urine. So it depends on what surgery we are going to go through, and there are some factors that can help in prevention of why we need a surgery at a later date. Like for example, someone with urinary incontinence. We take a detailed history, examine them, teach them pelvic floor exercises, look into the causes or root cause of their problems and try to treat them. So for them, prevention with good dietary and fluid techniques and exercises are the first step. The next one is for prolapse. Prolapse is when the womb comes down. For them, also prevention is possible, especially if they do regular Kegels exercises, that is pelvic floor exercises. So these are the steps for prevention. But when they actually need a surgery, we usually evaluate them to make sure they are safe to undergo a surgery and see if they have any medical problems that need to be corrected before going for surgery. There are certain specific steps we tell them to take care of after the surgery. Most of the time, it's a good technique at the surgery and a good post-operative care that is needed for a good recovery, so the recurrence or coming back with the same problem can be reduced. So we ask them not to lift too much of heavy weights for a period of 6 weeks after urogynec surgery, and also to take it easy and not do strenuous or over strenuous jobs. Bending and lifting heavy weights have to be reduced, and they have to hydrate themselves very well so they can prevent a relapse or recurrence of the problem, because sometimes if you have constipation or constant strain down there will increase the chance of the problem coming back. So we want to avoid people having constipation. Adequate hydration and use of laxatives when needed will go a long way in preventing the problem to come back. Some surgeries we recommend not to have pregnancies or vaginal deliveries after some urogynecological surgeries. For example, if women have urinary incontinence and we put a mesh or a tape, then we really don't want another pregnancy to increase the chance of problem coming back again. So we wait for them to complete their family, and when they are not contemplating any further pregnancy, then undergo urogynec surgery. There are certain surgeries which we can do but still advise them to go ahead with pregnancy. Like if someone who never had children have a prolapse or the womb coming down, for them they might require some intervention, but for them we might say yes for a pregnancy, but the chance of problems coming back in pregnancy and after delivery will be quite high. So we advise them accordingly. But most of the urogynecological surgeries we might say no for the pregnancy.